Well, a short while ago, U.S. President Donald Trump tweeted that he would be discharged from hospital later today. We now cross over live to Washington to hear a briefing from the doctors.
He's met or exceeded all standard hospital discharge criteria. He'll receive another dose of remdesivir here today, and then we plan to get him home. It's been more than 72 hours since his last fever. Oxygen levels, including ambulatory saturations and his work of breathing, are all normal. Though he may not entirely be out of the woods yet, the team and I agree that all our evaluations, and most importantly, his clinical status, support the President's safe return home, where he'll be surrounded by world-class medical care 24/7. I'd like to bring Dr. Dooley up to review some more specifics.
Good afternoon. Just a brief update this morning. As Dr. Connolly mentioned, the President continues to do very well. His vital signs this morning were notable for a temperature of 98.1. His blood pressure was 134/78. A respiratory rate of 17 respirations per minute. His heart rate was 68 beats per minute. And his last oxyhemoglobin saturation was 97% on room air. He currently does not endorse any respiratory complaints. And aside from our evaluation with the multidisciplinary team this morning, has maintained a full schedule, ambulating and working on the White House medical unit. I'll now turn it over to Dr. Garibaldi to again discuss therapeutics. Thanks.
Hi, good afternoon. And again, I just wanted to echo the sentiment of what an honor it is to be part of this wonderful team here at Walter Reed. Yesterday evening, the President received his third dose of remdesivir. He tolerated that infusion without difficulty, and his kidney and liver function continued to be normal. Our plan is to give the fourth dose of remdesivir this evening before he goes back to the White House, and we've made arrangements to deliver the fifth and final dose of his treatment course at the White House tomorrow evening. He continues on dexamethasone, and again, the plan for today is to continue to be up and out of bed, eat and drink, and work as he is able. And I'd like to turn it over to Dr. Jason Blaylock, who's an infectious disease specialist and the Chief of Medicine here at Walter Reed, to give some updates on infection control. Thank you.
Good afternoon, everyone. First of all, I just want to say what an honor it's been to be part of this medical team behind me and to care for the President. Since the President's arrival at Walter Reed, he's received medical management that remains in line with national clinical societal guidelines for treatment of COVID-19 infection. In addition, both myself and Dr. Wes Campbell have worked very closely with various laboratories in the area, state-of-the-art facilities to include USAMRIID and RARE, on obtaining advanced diagnostic testing to really inform the White House medical team of both the status of the President as well as his ability to transmit virus to others. Also, we have worked very closely with the Walter Reed team to ensure that we are looking very closely at infection control prevention strategies and the right posture so that the President can safely return to his residence. And with that, I'm going to turn it over to Dr. Conley, who will answer any final questions.
Thanks, Jason. I mentioned it Saturday, but I'd like to reiterate myself just how grateful the President and I are to the men and women of Walter Reed, our colleagues at Johns Hopkins, as well as the many federal, private institutions that we've received support from. And so long as everything continues on the track that we're experiencing right now, this time, as the President already tweeted out, is to get him home later today. With that, I'll take a couple questions.
Discharged back to the White House when he was given steroids. You've said that he's still on those steroids. Those are medicines, as you know, that are usually given to COVID patients who are on ventilators or with low oxygen. So did you overtreat him? And if he's still on that medication, how is it safe for him to return to the White House?
So we send patients home with medications all the time. In fact, yesterday afternoon, he probably met most of his discharge requirements safely from the hospital. And he's returning to a facility, the White House Medical Unit, that's staffed 24/7, top-notch physicians, nurses, PAs, logisticians, and the unit here, the team here behind me is going to continue to support us in that nature. Yes?
What infection control measures are you taking? And how was it safe for him to drive around in a cloth mask yesterday? And how is it safe for him now to return to the White House where there have been so many cases? How is any of this safe?
So the president has been surrounded by medical and security staff for days wearing full PPE. And yesterday, the U.S. Secret Service agents were in that same level of PPE for a very short period of time. We've worked with our infectious disease experts to make some recommendations for how to keep everything safe down at the White House for the president and those around him. We're looking at where he's going to be able to carry out his duties, office space, and I'll just say that it's in line with everything we've been doing upstairs for the last several days.
Can you tell us, please, on testing, can you tell us when he had his last negative test? Was it Thursday? Was it Wednesday? Do you remember when he had his last negative test?
I don't want to go backwards.
Contact tracing for people who are around him to know
I
when
understand.
he
The contact tracing, as I understand it, is being done. I'm not involved in that. So.
Why did you begin the recommendation that he leave, or was this something he pushed for?
No. So we try to get patients home and out of the hospital as quickly as is safe and reasonable. Every day a patient stays in the hospital unnecessarily is a risk to themselves. And right now there's nothing that's being done upstairs here that we can't safely conduct down home.
You said that 7 to 10 days was a window that you'd be concerned about. I don't think we're there yet. So do you have concerns about potential worsening or reversal, and what are your plans for addressing that if it were to happen?
You're absolutely right. And that's why we all remain cautiously optimistic and on guard because we're in a bit of uncharted territory when it comes to a patient that received the therapies he has so early in the course. So we're looking to this weekend. If we can get through to Monday with him remaining the same or improving, better yet, then we will all take that final deep sigh relief. But as I said, 24/7 world-class medical care surrounding him down there. We're not going to miss anything that we would have caught up here.
Oh, that was Dr. Sean Conley outside the Walter Reed Military Hospital giving an update on President Trump being discharged. However, noting that he is not out of the woods just as yet.